Well, welcome back. I'm Grid 7, and here we have if you didn't know, the Golden Globes were last week, but several celebrities test positive for COVID after Golden Globes. Oh my goodness, the world is coming to an end. I mean, in the wake of the Golden Globes last week, several celebrities said they have tested positive for COVID-19. At least 4 stars, including Jamie Lee Curtis and Michelle Pfeiffer, revealed they contracted the virus following the awards show. In response, the Critics' Choice Awards, which was held on Sunday, I didn't know that either, announced that all attendees would be required to submit a negative COVID-19 test before entering the venue, according to the deadline. Public health experts said the news of the actors and actresses falling ill is not surprising due to the relaxed regulations and the people gathering indoors. Okay, I'm sorry here. This has been going on now for a year outside of California and these little woke groups, this bubble group. I mean, you go to Texas, Florida, and all that. They've been doing this shit now for a year. You're a little bit longer, probably. This is the sort of window into what our future holds. Yes, our entire future and all that type of stuff depends on a bunch of celebrities going to a fake award show, said Dr. John Brownstein, an epidemiologist and chief innovation officer at Boston Children's Hospital and an ABC News contributor. Right there's the big thing, an ABC News contributor, which means he will follow the narrative. And the narrative is opening up bad. He continues here, I mean, this is not unexpected. You have indoor gatherings during a time when a lot of virus is circulating, whether it's cold or flu and proximity without masking, and especially if there is no testing requirements. Oh my God, the world's coming to an end. He continued, it's not surprising that you're going to have an active transmission of viruses, one of many respiratory viruses that are circulating now. You don't say. According to data from the Centers of Disease Control and Prevention, weekly COVID cases have topped 400,000 for the last 6 weeks. I like to go on over here to Bing, and I usually just type in COVID cases USA and new cases. Am I missing something? Either this date is wrong or this date is wrong, which figures not seen since late September, although the overall number has declined from last week. Meanwhile, weekly COVID deaths are trending upward, with 3,907 reported as of January 11th. CDC data shows, although some of this may be due to reporting lags over the holidays. Additionally, CDC data shows that while flu cases are declining, the cumulative hospitalization rate of 54.4 per 100,000 is 1.8 times higher than the highest figure recorded at this point in the year, dating back to the 2010-11 season. Yeah, if anybody was not paying attention to Australia, this catches you off guard. The flu season this year was described to be bad. It was bad in Australia, and a lot of people said it's going to be bad this year. So and a lot of that people were saying is because they were holed up. They weren't outside. Your immune system wasn't as good as it was a couple of years ago because of all this lockdown stuff. That actually is playing a part. They won't tell you this part because they want to lock everything down again. It is well known that infected individuals can expel droplets that move throughout an entire indoor space and even linger after a person leaves the area. What's more, with lack of ventilation, be it high-efficiency particle arresting filters or open windows, and people gathered closely together with no masks, Brian said, it's no wonder people contracted COVID. People were contracting COVID even without all that. I mean, geesh. We sort of have to decide collectively as a society what we want to do to keep transmission down. Obviously, we know that mitigation strategies help, and then we recognize that we still have a lot of vulnerable people that are succumbing to COVID. Yeah, people are still dying. No, it is bad. I'm not going to say no, not. There are a lot of things we can do. Also, one of the things also that people are now starting to figure out a little bit is this closing off isn't as good as we thought. Now, you are harming your immune system, and when you come back on out, you're actually maybe more likely to get COVID. But I think the idea of testing pre-gathering is still a good idea. So it makes sense that the critics' choice of words use that as a tool to help limit the amount of risk of transmission at the event. Again, narrative. Gotta push the narrative. Brownstein said this doesn't mean that every event will turn into a super spreader or that it signals trouble for the U.S. Rather, Americans shouldn't let their guard down. As much as people want to assume that we've moved on from the pandemic hasn't yet moved on from us. We're still dealing with events where that super spreading can occur, and there's a benevolent vaccine out there that can lower your risk of severe illness and help reduce your risk of severe consequences and deaths from the virus. And right there's the vaccine thing. And as some people have said, no question, aren't these people heavily vaccinated? After all, they're pushing for it. Are you telling me that they're pushing for it and not vaccinated? Well, you let me know. What do you think? Fear-mongering? Not? Doing a narrative? Let me know. Grid 7 on YouTube. You can also see me over on Rumble. Come on over there. It's much better. And I'll see you next video.